Hi guys, my beloveds, take your pens, papers, and let's go. Today's topic is thyroid surgery. So what surgery you use? Question like this, on thyroid glands, that is thyroid surgery. So actually, question for your exam tickets, board questions, board exams, thyroid surgery. Okay, let's go about thyroid surgery. We have start with types, because we've got types of thyroid surgery. We have a total thyroidectomy, total, that is removal of the entire thyroid gland. We have subtotal thyroidectomy, that is partial removal of the thyroid gland, often preserving for some types of some thyroid tissue, for some thyroid tissues. So total is total, removal of entire thyroid gland, and subtotal, it's a partial removal of the thyroid gland, often preserving in some thyroid tissue. Lobectomy, removal of one lobe of the thyroid gland. This is a lobectomy. It's a removal of one lobe of the thyroid gland. Isthmusectomy, so removal of the isthmus, the small piece of tissue connecting the two lobes. This is a small piece of tissue connecting of the two lobectomy, removal of the isthmus. Isthmus is a small piece of tissue connecting the two lobes. Isthmus, very important gland actually. Okay, so types of thyroid surgery are total, entire thyroid gland removal, subtotal, partial removal of a thyroid gland, lobectomy, removal of one lobe of the thyroid gland, and finally isthmusectomy, removal of the isthmus. Etiology. So what can be the problem? We have a benign nodules, multinodular goiter adenomas. We've got a malignant tumors, papillary, follicular, medullary, or anaplastic thyroid carcinoma, Graves' disease, toxic multinodular goiter, compression symptoms, large goiters causing dysphagia, dyspnea, or compressive symptoms. What else? Symptoms and signs indicating surgery, presence of palpable neck mass or nodule, symptoms of hyperthyroidism or hypothyroidism. So we have to make a differential diagnosis. We have the lecture like this, hyperthyroidism and hypothyroidism. So dysphagia, hoarseness or dyspnea due to a large goiter. Suspicious or confirmed malignant nodule on fine needle aspiratory biopsy. Diagnosis, clinical evaluation, detailed history and physical examination. Imaging, ultrasound computer tomography scan, MRI to evaluate the thyroid and surrounding structures. Fine needle aspiration biopsy, FNAB, to determine the nature of the thyroid nodule. Fine needle aspiration biopsy, FNAB, FNAB. So to determine the nature of the thyroid nodule, thyroid function tests, TSH, free T4, and other related tests to assess thyroid function. Classification, why not? Benign, includes nodular goiter, Hashimoto thyroiditis, malignant, including papillary carcinoma, follicular carcinoma, medullary carcinoma, and anaplastic carcinoma. So we have benign and malignant. Okay? Once again, benign nodular goiter, Hashimoto thyroiditis, and malignant one, papillary carcinoma, follicular carcinoma, medullary carcinoma, and anaplastic carcinoma. Concerning complications, do we have? Unfortunately, we do. Hypocalcemia due to accidental removal or damage to the parathyroid glands. recurrent laryngeal nerve injury leading to hoarseness and vocal cord paralysis or dysphonia, vocal cord problems, vocal cord dysfunction, yeah. Bleeding, that is hematoma formation, potentially life-threatening if it leads to airway obstruction. Infection, rare but possible, leading to wound issues or abscess formation. Thyroid storm, rare but serious hypothyroid crisis, especially if surgery is done for hypothyroidism. Hypothyroidism, often a planned outcome requiring lifelong thyroid hormone, lifelong replacement, hormone replacement therapy. How to manage this treatment and management post-surgery? Hormone replacement therapy, of course, levothyroxine to manage hypothyroidism post-thyroidectomy, calcium and vitamin D supplementation. If hypocalcemia is present, calcium and vitamin D supplementation. Yes. Monitoring, regular follow-up with TSH levels, imaging if needed, and monitoring for recurrent or residual disease. Voice therapy if there is a damage to the recurrent laryngeal nerve. Largely sufficient, I suppose, for your exam. Thanks for your attention, my beloveds. Don't forget to follow and subscribe the channel Dr. Y, and